My name is Rebecca, and I consent to being recorded. Hello.
Hi, my name's Diamond. How are you?
Good. How are you?
Good. I'm going to be your nurse today.
Okay.
Can I have your first and last name?
Rebecca Castillo.
Okay. And your date of birth?
4396.
Are you allergic to anything?
No.
Okay, perfect. I'm going to just start by washing my hands. Alright, now I'm entering back into the room. Do you have any pain today?
No.
Alrighty. So today I'm going to be doing a head to toe assessment on you. Is that okay?
Yeah, that's fine.
Alright, perfect. So we're going to start with just doing some vital signs on you. And you said you're not allergic to anything, right?
No.
And no pain?
No.
Okay. Gonna get your blood pressure. Can you just take that off? Thanks. Putting the bed up to working high. I'm going to put this pulse ox on your finger. This is going to be checking your oxygen levels. And I'm going to go ahead and get your blood pressure. (116/62). Does that sound about normal for you?
Yeah.
Alrighty, and I'm looking at this pulse ox and it's reading 100%, which is great. And now I'm going to go ahead and just check your pulse. So I will be checking for 30 seconds and just timing that by 2. Okay, and I got 40, so that by 2 is going to be an 80. And I'm going to go ahead and check your temperature. (98.2). All right, perfect. All your vitals look good and stable. We're gonna go ahead and move on. Do you know what year we're in right now?
2024.
And where are you?
At the Valencia College.
Okay, perfect. And what year were you born?
1996.
Okay, perfect. Checking the more, and I'm confirming she was born in 1996. As I'm assessing her, I'm noticing she is breathing, so her airway is okay. Her level of consciousness is great. She's ANO times 4. No pain. And now I'm going to go ahead and just start with your head. So is it okay if I touch you?
Yeah.
Okay. So I'm looking at your head. I'm looking to see if there's any cuts, lesions, bruises. I see nothing here. It looks nice and intact. Do you have any excessive hair loss that you have seen?
No.
Any hair loss that you have noticed? No. Okay, perfect. Looking at your eyebrows, they look nice and intact. Eyelashes look good. Face symmetrical. No masses, lesions, cuts, bruises. Any past surgeries anywhere in your head, at all?
No.
Okay, perfect. All right, and I'm looking at the face, and nothing looks swollen to me. Eyelids look great. I'm gonna go ahead and look at your eyes. Okay, you can take off your glasses for me. And I'm gonna pull down on your eyelid so I can just check. Okay, perfect. And perfect. Okay. Nice and clear. I was checking her cornea, checking her iris at the same time, looking at her eyelids and her sclera. Color looks great. Everything's nice and clear. Now I'm going to go ahead and move on to your ears. We're still in the face area. No recent headaches or ear infections?
No.
Okay. Looking inside the ear, and it looks nice. Okay, no cuts, lesions, bruises, symmetrical in those areas. And I'm going to go ahead and look at your nose. Looks great. I'm looking inside. Okay, no recent nosebleeds that you know of? Okay, perfect. Nose is symmetrical, no discharge, no lesions. I'm going to go ahead and now assess your mouth. If you could say ah for me. Say ah. Okay, perfect. And you have all your teeth?
Yeah.
Any dentures?
No.
Okay. Alrighty. Now at the same time, as we're still in the face area, I'm going to go ahead and assess your lymph nodes. So I'm going to start with the posticular auricular, and that's going to be behind the ear. So I'm just going to be feeling you to see if I feel any lesions, lumps, or bruises. If I do, I will state that. As of right now, I do not feel any. Now we're going to move on to the occipital, which is behind the eyes. Let me go back to the posterior auricular, which was behind the ears. Okay, that feels good. Now I'm going behind the eyes. Feels great. The submandibular, which is going to be the lower jaw. Great, nothing there. Supraclavicular, which is going to be the clavicle or the collarbone. And nothing. And now we're going to go ahead and assess the thyroid. I'm going to feel first. Can you swallow for me? All right, perfect. Feels good. No, no masses that I have identified or felt. Gonna go ahead and move on to the cranial nerves. I'm gonna start with the cranial nerve number 2, and for that one, I would be checking your vision, and if we had it available to us, I would be using the Snellen chart on you. Now I'm going to move over to cranial nerves 3, 4, and 5. So I'm just going to be doing your 6 cardinal fields. So I'm going to go ahead and tell you to follow my pen light. perfect. So her eyes did move in the directions that I needed it to move in. So we're good there. There was no gaze that I was noting. And now we're going to move on to cranial nerve number 8. And this is going to be the whisper test. So I'm going to say a word in your ear, and then you let me know out loud what it is. Can you hold one ear shut?
Oranges and apples.
That's correct. Any other ear?
Pink and purple.
Pink and purple is correct. Now we're going to move on to facial nerve number 7, and this is going to be, we're going to move on to cranial nerve number 7, which is the facial nerve. And now I'm going to tell you if you can lift your eyebrows, puff your cheeks, stick out your tongue. All right, perfect. And can you show me your teeth and smile? And can you frown? All right, everything looks symmetrical and fine. And I'm going to move on to olfactory, which is the first cranial nerve, and this is going to be testing your smell. So can you close your eyes and let me know what you smell?
Oh, that's lyrical. Alcohol.
Okay, perfect. Okay. And you passed that one. So now we're going to move on to cranial nerve number 9 and 10. And this is going to be, well, we already did 9 and 10, but to add to that, because you said already for me, I'm going to go ahead and verbalize that I did assess your gag reflex, and that was okay, so you passed that. And now we're going to go ahead and move on to cranial nerve number 12, and just stick out your tongue for me and move it side to side. Okay, perfect. Now we're going to move on to cranial nerve number 5. So I'm going to have you close your eyes and let me know if you feel a soft sensation or a dull sensation. Okay. And what do you feel?
Soft.
Okay. Now, what do you feel?
Sharp.
Okay, great. One more time.
Sharp.
And now? Oh, you can close your eyes. Now?
Soft.
All right, perfect. So now we can go, and she passed that one. And then our last cranial nerve is going to be the accessory one, which is number 11. So could you sit up a little bit for me? Perfect. And is it possible for you to move your shoulders up and down? Perfect. All right, so she went ahead and passed out. So we go ahead and finished off with our cranial nerve. So now we're going to go ahead and assess your skin. So I did your hair assessments, and while I was looking at your hair, I assessed that there was no skin issues that I noticed from your scalp wise and on top of your head and your face. And your hair has good distribution. I'm going to go ahead and just look at your nails. Okay, there's no cuts, no lesions, no bruises. She has good skin. Now we're going to go ahead and just going to look at your skin turgor and your cap refill while I'm at it and looking at your fingers. And at the same time, I also, as I've been touching her, I've been seeing if I was seeing any excessive warmth, and I have not. All right, and it's going to be less than 2 seconds for me. So she passed that area. And I'm also been looking to see if she had any edema, and I'm giving it a 0. There is no edema suspected. Now we're going to go ahead and move on to some mobility. So is it okay if you move your head from side to side? All right, perfect. I assessed that. And I'm looking to see if the head moved side to side to see if it was symmetrical, and it was. Now I'm going to go ahead and see how your strength is. So can you hold my hands and can you squeeze for me? Okay, and we got a +5 on that. And I'm verbalizing that her joints are color wise that I can visualize are okay and no edema as well. And can you push on the palm of my hands? Okay, perfect. And they are strong equally bilaterally. Now I'm going to assess your carotid artery on your neck. So we're not going to be doing this together at the same time because then it will cut off some of the circulation and we don't want that. So I'm going to do it one at a time. First, I'm going to assess it. Okay, and now I'm going to auscultate it. Alrighty, sounds good. Now I'm going to go ahead and move on to I'm going to just check your pulses. So I'm going to start at the brachial. I'm giving it a +4. And now we're going to go down to the radial. All right, +5. And now can you put your knees up? And I'm assessing her popliteal. +4. And now moving down to the dorsalis pedis. +4. And then we're going to be moving on to the posterior tibial. And a +4 on that. And we did go ahead and did the cap refill already, so we're good on that area. Pulses feel great. All right, now we're gonna go ahead and move on to the cardiac. And now I'm verbalizing that there is no presence of any masses, pulses, or any heaves that I have been seeing. Any history of cardiac?
Nope.
All right. And now I'm going to palpitate for any of those masses if there was any present. And I feel nothing, which is great. Now I'm going to go ahead and auscultate and listen to some heart sounds, placing them in the right placements of the aortic, pulmonic, herbs, and tricuspid. All right. I'm going to listen to your apical pulse for 1 minute. Alrighty. And I got 82 on that number while I was listening. Alrighty. Now, while I'm in that same area, I'm gonna go ahead and just inspect your respiratory. So, I'm going to see your work of breathing, and I see no distress in your work of breathing, and you're breathing okay, and it looks symmetrical bilaterally. And now I'm gonna palpate for any masses or tenderness on your chest. Don't feel anything. Are you asthmatic?
Mm-mm.
Okay. Everything feels great. And now I'm looking also for the symmetrical of your chest expansion while you've been breathing. And I have noticed that you have been breathing okay with no distress. And while I was doing your apical pulse, I was also looking at your breathing, and your respiratory rate was at a 17. Now I'm gonna go ahead and listen to the areas of your respiratory, and I'm gonna be listening to all the lobes. Working my way from side to side. So if you could just breathe normal for me, and I'll let you know when to take a deep breath. Okay, and I'm just gonna check from the back as well. Can you take a deep breath? And another. One more. And last one. Okay. Thank you. Breath sounds are clear with no wheezing or any crackles that I have noticed in any of her lung areas or any of the lobes. Now we're going to go ahead and work our way down to your abdomen. Does your belly feel okay?
Mm-hmm.
And have you had when was your last bowel movement?
Yesterday.
And have you been urinating okay?
Mm-hmm.
All right, perfect. No burning? Okay. And now I'm going to go ahead and take a look first before I touch. Can you lift up your shirt just a little bit for me? That's great. And I'm putting the bed back so that her muscles are more relaxed and I can assess the way that I need to. So now I'm just taking a look right now, and it looks great. There's no past surgeries, no scarring, looks intact. And now I'm going to go ahead and feel. Just kidding. I'm not going to feel right now. I'm looking, and I'm going to listen before I feel. Starting in the right lower quadrant and working my way up. Did you just eat?
Yeah.
Okay, so her bowel sounds are hyperactive right now. They sound like very gurgly and a lot of movement going on in there. So now I'm going to go ahead and just assess with my hands now. Or inspect. Any pain?
No.
Okay, and I'm going to percuss a little bit. All right, perfect. If I did not hear anything in her bowel sounds, then I would be listening for 5 minutes and making sure that I did not hear anything, but I did because they're hyperactive right now. I'm also going to go ahead and have you just sit up really quick. I'm going to assess for your angle tenderness bilaterally, the quarter vertebral in your back. And let me know if you have any pain. I'm going to go ahead and percuss.
Mm-mm.
Did it hurt?
No.
All right. before we end, I'm gonna go ahead and work my way down to your legs. And I'm also looking at her skin here. It looks okay. And I'm gonna ask if you can push on my hands, and I'm checking for strength, and that's a +5. It's bilaterally equal. And I'm going to check the cap refills on your toes. Alrighty. And we got a +2 or less than 2. I'm so sorry. Alrighty. So, any other questions for me? Okay. Alrighty. So we are at the end of our assessment, and I'm going to tell you, have a good day. Please come back and see me if you have any questions or change. And I'm going to take off my gloves, make sure all my equipment is wiped down. And I'm putting the bed down for safety. This is the lowest that it goes. And I'm going to wash my hands if there was a sink right here, which there's not. Thank you. Have a good day.